Good afternoon. I'm Dr. Beatriz Moya, a resident in allergy from Spain, and part of the EACI Junior Member Representative for the food allergy section. Today, it's my pleasure to discuss with Professor Mika Mäkelä, who works in Helsinki University Hospital, one of his studies recently published in the Journal of Pediatric Allergy and Immunology. It is called Outcome of Oral Immunotherapy for Persistent Cow's Milk Allergy from 11 years of experience in Finland. So, good afternoon, Dr. Mäkelä. Could you please explain the rationale of this study?
Good afternoon, Moya, and thank you for having me on this very important subject. We need oral immunotherapy long-term studies. We have very little knowledge so far about the real effectiveness if we look at the therapy in 10 years. And this is why we have been following these patients, what we started more than 10 years ago, and now we want to see how they are doing really in real life.
What are the main outcomes of this study?
The main outcome is very positive. 53% are using more than 2 deciliters of milk every single day, and there are 18%, additional 18% who are using less than 2 deciliters, but it's actually 32 times higher level of daily milk than they had when they were first challenged before the treatment. So that means that more than 70% are actually using, after medium follow-up time of 6.5 years, still a lot of milk.
Okay. So your results show that few children suffer from an anaphylaxis during both the build-up and the maintenance phase. Were there any baseline patient characteristics who predicted a higher risk of an anaphylaxis?
Yes and no. In a way, there are some features which are common to these patients. Number one would be that they have very high levels of specific IgE to milk. Not necessarily total IgE, but specifically to milk. Another thing is that if they have very, very low eliciting dose in the beginning in the oral food challenge, that would be a combination which makes you more likely to have anaphylaxis and problems, particularly during the post-build-up phase.
Were there any baseline patient characteristics who predicted the failure of oral immunotherapy?
It really is that if you have extremely high IgE and you have respiratory symptoms during the post-build-up phase, that seemed to be really the trickiest combination. So those kids who would have like asthma symptoms or wheezing or any type of respiratory symptoms, they would be having more likely some trouble later on and also perhaps discontinuing.
Okay. So to summarize, how the findings of your study could facilitate the selection of children with persistent milk allergy who will benefit from oral immunotherapy?
I would say that most children are good candidates for milk OIT, particularly those who have fairly normal levels of specific IgE. I would be very careful with those with very high IgE level, with very low eliciting dose level, and who have asthma. We had one case particularly which had really bad adverse effect when you had asthma exacerbation, and in top of that, the mother did not stick to the protocol. So in EACI guidelines, we have also emphasized that it's very important to strictly go with the protocol that you have been assigned.
Okay, thank you very much for being with us today.